All right, I want to talk to you about something that it matters to me. I travel a great deal. I don't really know what is going on at some of the places I eat. Look at how many times we all eat out. The year ended July 10th, July of 2010. So from July of 2009 to 2010, 59 billion restaurant visits in the U.S. That's 193 restaurant visits per person in the United States. Over the next 10 years, it is predicted that we will increase by 8%. So by 2019, we'll be going to restaurants even more than we do now. That's an issue because you can't control what you eat at restaurants the same way that you can control what you eat if you cook at home. So what if you really need to know what is in that food? Maybe it's because you have a health concern. Maybe it's because you just want to eat better. There's now an application. There's a restaurant in Atlanta that actually allows you to do that with technology, but there's an application that you'll be able to use on your portable devices or on the internet to try and find out this information ahead of time. You can manage blood pressure. You can manage salt intake, sugar intake, things like that. I want to introduce you to a couple people who are in the studio in Atlanta right now with a demonstration of this technology. Beth Minot is a professor at the College of Computing at Georgia Tech. She's on the left. Jiten Chabra is a physician and a researcher with human-computer interaction, also at Georgia Tech. They're going to tell us a little about this. Folks, thanks for joining us. Beth, tell me what this is about.
You're welcome. What we're trying to do is change the face of healthcare delivery. And by that, we want to connect people with the most relevant and current healthcare information and make that information actionable and available in their daily lives. So in many cases, management of health, management of chronic disease is about what you eat day in and day out. In our research, we realized that people had hundreds of questions about what they should eat at the restaurants, just as you described.
So what have you got there? You've got behind you the web application. Tell me how that would work.
So what we've done is we've created this application, and you can walk in, and based on your healthcare needs, it provides a personalized meal recommendation just for you.
All right, you guys got a demo for me?
Yes, Jiten?
Okay.
Right, Ali. So I'm going to jump straight into the demo and show you how we do that. So imagine you walk into this Atlanta restaurant. It's called Tin Drum. Instead of ordering from a regular paper menu, you order from this digital menu. The first thing the menu asks you is, what is your health goal? And that's kind of the crux of this whole application, that it gives you personalized advice at the time of ordering. So let's say I'm just trying to stay healthy, and I would like to order from the menu. Now, what you're seeing here on the screen is a list of all the items from the Tin Drum menu that are ranked in order of healthfulness of the probability of them making you achieve that goal. So let me kind of start over. Now you can see that if I choose a different health goal, if I'm trying to manage diabetes, then the items are going to be different. The healthiest item at Tin Drum to help you manage your blood glucose levels is the Sing Chow Mein with beef, and it's different from you trying to build muscle, or it's different from you trying to lose weight. So that's the first aspect of this menu right here.
All right, and Beth, let me ask you this. Part of the issue here, and this is what happens with me, I try and know which one of those things I've got to do, but it's sometimes counterintuitive at a restaurant. I mean, you're sometimes very surprised that the thing you think might actually be healthy either isn't because of its ingredients or its method of preparation.
Yep, exactly. I've been surprised because I go to this restaurant every week, and the things that I thought were the best for me, because I was trying to minimize salt and calories, turned out to be the wrong items. And so I would see a personalized recommendation and say, okay, well, but what if I want to order this? And then it provided the information and compared the two meals so I could see where the real differences were.
Where does this go from here? I mean, I'm going to have to try out this restaurant in Atlanta, but the reality is for my viewers all over the country, how do you scale this up and make this something that I can use when I'm on the road, my viewers can use wherever they live?
So the important thing about this is it's a web-based application. So we have it in a kiosk at Tin Drum, but it can be available to you in any restaurant because we can match the nutritional information about what the restaurant is serving with what your health needs are. So it can be available on a mobile device or available on the web. You can decide what you want to order before you go there.
But you've got to get it out there so that restaurants can sign up and be part of it.
So we're going to get it out there. It's at Tin Drum right now. It's at Fresh to Order right now, and we're looking for more restaurants to partner with.
Let's do it. Let's get those restaurants on that program. That is going to keep us all healthier, and it means that we don't go and say things like it's not healthy to eat at restaurants. It's good for the restaurant industry, right? Because you can go out and you can keep eating at restaurants. It's good for the economy, and you can stay healthy. I love this. Thank you, folks. both for this big eye. Beth Minot is a professor of College of Computing at Georgia Tech. Jiten Chabra is a physician and researcher at human-computer interaction at Georgia Tech. Georgia Tech is going to be highlighted, by the way, at the Future Media Fest 2010, October 4th through 7th. For links to Useable Health's website and Future Media Fest, head to my blog, cnn.com/Ali. I love that one. I want that one to work.